As COVID cases in Taiwan surge, I speak with National Taiwan University Public Health Professor Chang-chuan. Well, I know that you have been advocating that Taiwan should shorten or simplify its quarantine for arrivals. Tell me why you think Taiwan should be shortening its quarantine.
Taiwan now has an infection rate comparable to Singapore's and higher than the majority of neighboring countries. Our infection rate also are higher than US and comparable to Europe. All these countries, as to some extent, has already opened up. The ratios between domestic identified cases versus imported cases, the ratio is now over the 100 times. So the risk is inside, not outside.
So I did notice that Health Minister Chang-chuan did mention that they're still keeping quarantine in place because of the concern for different variants. What do you think about that concern?
The theories of variants occurring is the more infection you have, the more risk of new variants coming out. So if in the future there will be some variant, I would say the risks coming from our domestic infections will be higher than, from outside.
With this surge of cases and the trend of it multiplying, where do you see Taiwan's death rate going at a time like this?
By judging the Omicron's pandemic in different countries, it takes about 1 month to reach daily cases around 100,000 or above. And it takes about 2 months for this wave of Omicrons to come down to certain levels.
At what point do you think that COVID is treated just like any other disease, like the flu, where we don't need to quarantine, we just rest at home?
COVID is not like flu yet because it's more transmissible and the severity is higher than flu. So we cannot treat it exactly like flu.
Are you optimistic about Taiwan's outlook in dealing with COVID now with the current situation?
Yeah, I'm cautiously optimistic. Our society as a whole are still in the mentality of zero COVID that we enjoyed in the last 2 years. It's hard, the society, to move to the space of living with virus, which we cannot have zero risk. We can control some risk. If we can solve this social psychology as fast as possible, then probably we can move smoothly. Otherwise, I'm afraid the casualty and the cases will keep on rising, and that's what I don't want to see.
Oh, so you think there's too much anxiety about COVID? Is that what it is?
Definitely, it's too much anxiety because 2 years after this pandemic, we have learned more and more about this virus, and we have more tools. We have vaccines for people to be vaccinated. We have very useful antiviral medications that we can use to prevent people from infection to mild diseases. So it's totally different game now that we humankind has the tools to fight with this virus. So should not be as fear as we had 2 years ago. I hope our citizens, after learning the facts, can start to have this mentality of accepting a level of risk to live with this for the years to come. That's the post-normal society of this pandemic.